breakthrough objectives address a subject matter in need of improvement. The objectives will drive improvements to make things better for patients and staff alike. As part of our divisional breakthrough work, we as Acute Care Division have been piloting the new ways of working. This has been successful at other trusts to implement sustained change and improvement. Using the A3 thinking method, we use the 8 steps to problem solving. Number 1, clarify the problem. Number 2, break the problem down, looking at the data, what that tells us, and mapping out waste and defects in a process. Number 3, target setting. Number 4, root cause analysis and looking at the gaps between the current and future state. Number 5, develop countermeasures. Number 6, see the countermeasures through. Number 7, monitor progress. And number 8, what have we learned and what can we share?
Our first quality breakthrough objective is reduce the incidence of hospital-acquired pressure ulcers. We start by identifying the problem. In ACD, 10 patients acquired pressure damage in July 2024. This resulted in avoidable harm and a poor patient experience.
We have broken down our problem and delved into the data. We have created a validation process so we are able to see each hospital-acquired pressure ulcer by category and to ensure the datex is coded correctly.
We have completed an audit in relation to equipment that is used to support patients with vulnerable skin. Observational work that has been supported by the Quality Improvement Team has commenced. This provides us with real-time information on our processes of caring for patients with vulnerable skin.
We have gone on to develop a root cause analysis, identifying areas for improvement in equipment, documentation, environment, patients, policy and education.
Countermeasures are a set of actions that we all commit to work on to impact on the overall objective. For pressure ulcers, this is looking at equipment, documentation and standardised process.
Moving on to our second breakthrough objective, complaint performance. Again, we identify the problem. ACD are not consistently achieving the required complaint KPI performance of 85% as set by the Trust. In July 2024, 90% of complainants received their complaint within the agreed timeframe. This leads to a poor complainant experience and negative reputation for the division.
We then broke down the problem, looking at the performance of the KPIs, delving further to understand how many extensions were agreed, how many reopened complaints, how many family meetings we are offering, how many are cross-divisional, and a breakdown of each area of the teams.
Again, we went on to develop a root cause analysis for the areas identified for improvement: communication, workforce, quality, patient and policy.
We have developed countermeasures to help us achieve our goal. These include the development of a complaints management team, bespoke ACD complaints training, and contribution towards the Trust's review of the complaints process. So far, these countermeasures are having a positive impact on our breakthrough objective.
Our third breakthrough objective is increased compliance of sepsis standards. In ACD, patients did not receive appropriate sepsis screening and treatment in July 2024. This has resulted in deterioration of patient outcomes and avoidable patient harm.
Breaking down the data, we identified that there were some inaccuracies in how the information of sepsis screening and the administration of antibiotics were recorded. We have worked with our colleagues in the clinical audit team to rectify this. We have completed observational work to identify our current processes for sepsis screening and the administration of antibiotics.
Alike to the previous two breakthrough objectives, we will now go on to develop our root cause analysis and countermeasures.
This is where we need you. We need your ideas and your thoughts on each of our quality breakthrough objectives: pressure ulcers, sepsis, and complaints. You will receive a short survey monkey via email asking for your opinion on these 3 objectives. Alternatively, please feel free to email your ideas to midyorks.acdclinicalgov@nhs.net.
Thank you for taking the time to listen to our quality breakthrough objectives.